So you are planning for lingual cortical engagement. So when you drill, first feel will be crestal bone. Okay. If there is lot of cancellous bone here, immediately you feel the drop. If there is no such, you won't feel the drop. The bone here will be very thick. Then you will feel the resistance here. You will feel no, you have to give pressure. Slowly give the pressure, don't put very wild pressure. So at this point the drill will come out. That is called the drill drop. Then use the parallel drill. Again the drill also will drop, measure. Okay. So from the crestal, whether crestal drop is there or not, first feel. Then what is the intramedullary bone, call it, that is another feel. Then at the end, is there any C2? Then that is the feel. If nasal floor is there, you are drilling, when you are reaching the nasal floor, you are feeling the resistance, then drop. So two things. One is the resistance you will feel, and another is the drop. These two feelings you have to understand. In all parts of the jaws, you will feel the resistance at the end, except only one area. Distal mandible, when you are planning for intramedullary canal. If the mandible is like this, there is canal. When you are drilling, where will you feel the resistance in the drop? You won't feel. You may feel the resistance here and you may feel the drop here. So when you are planning for intramedullary, you should be careful. You cannot expect any resistance or drop there. Just roughly drill minimum available length. Already you might have planned, no? Already you have decided in your mind, the canal is closer, I am going to place 6. The canal is closer, I am going to place 8. Just whatever you plan, blindly you place in the and come. It won't change. But other areas, based on the drop, your plan length will change slightly. Okay, for example, lower anterior you are doing. You are drilling and you are feeling the resistance here. Where you feel the resistance, you measure and you place. Okay, so myeloid ridge engagement you are doing. Where you feel the drop, you are measured. Where you feel the resistance here, you measure. Where you feel the drop, measure. Where you feel the drop, you measure. But only here, where distal mandible, intramedullary, don't expect any resistance, don't expect any drop. Fix the length already. Just drill it and place it. You cannot measure the length during the intrasurgery for distal mandible. Diameter you can measure. Open the flap, the ridge is very thin, wide or very wide, you can select.
First we are putting parallel drill.
Yes.
After parallel drill.
Okay. So we'll see one by one interferon. This is 4 area. Okay, this is correct. This is the anterior extension of the maybe the canal. But here threads are engaging the buccal and lingual plate. Once we connect with the welding, everything will as a unit. This is 3.5, 14 or 16. It got nice stability. Straight drilling. Here also compressive. Here also compressive. This is the metal. This is the distal mandible where the lingual island, no? Okay, we are safer. This is the myeloid ridge. Here we get the nerve. So we are safer, the nerve is safer. This is the 6 distal socket, right? Yes, it is perfect. We could have selected a 4.2 to 11.5 also. Okay, but 1 mm may go out. Yes. So now we have to bend it now. So this is the right side. We could have placed a tool also. But we have got gain of stability now, because it is engaging this crestal cortical bone. This is also cortical, this is also cortical. Here also. We could have selected a longer one also, 3.5 total, but this is enough. Once you do the welding. So a detailed planning before starting the surgery using CBCT, opening the flap and feeling using all the sensations and selecting the proper dimension length. Full mouth are very easy than single and partial, because you have got more freedom to choose your site. Okay. Only thing, if you are welding, you just weld it, then you can do the process relaxed.